bad blood. You just gave birth, and everybody's telling you you need to tie your tummy so that the bad blood in there can come out. You need to drink this, you need to do this, you need to do that, because the bad blood inside your tummy after delivery needs to come out, else something's going to happen to you. So today's video is all about the bad blood many people talk about or many new moms get scared of. So this video is focused on bad blood after delivery. So if you're new here, you're welcome to this channel. This is First Time Moms, and on this channel we'll talk about health for mothers, health for new and expectant moms, health for babies. And if something you're interested in, join the family and let's dive right into today's video. So what is this bad blood after delivery? You can simply call it vaginal discharge after delivery, or if you want the other name, lochium. And it is the discharge, the fluid, the blood that comes out from your vagina after delivery. As much as it is going to be bloody at first, it's important you know that you don't need to do anything drastic about it. It's a sign that your body is healing. You don't need to do something drastic that can even cause you more problems or more complications after delivery, because oftentimes you now see new moms because they want that bad blood to come out, they want their tummy to, because they've been told if you do not allow the bad blood come out early, you're going to have big tummy, your tummy will not return to size, you're going to be bloated, you're going to be bigger than how you used to be before. Sometimes a mom ends up tying her tummy for several hours, and these are things that can put you at risk of complications after delivery, including prolapse after delivery, in which the organs in the abdomen start shifting and starts coming out. For instance, you hear a mom say, "Oh, since I gave birth, I'm sitting on a ball." When a mom says that, that's a sign that the womb is shifting out, it's coming out through the vagina. That's what we call prolapse. So when it comes to this bad blood often talks about, you need to be very careful, because many people are taking drastic actions. At the end of the day, they're even in more problems, more complications than what they were even trying to avoid. So what again is this bad blood? When pregnancy, as baby was growing, have the placenta, so was also the fluid in your tummy, the blood volume in your tummy. Everything was increasing. Now you're put to bed. So nature has a way of telling the body, baby is out and we do not need this excess fluid in the body. We do not need this excess blood in the body. So after delivery, you're put to bed. Nature has a way of bringing out these things out of your system. So that's basically the discharge you're going to be seeing after delivery. It is different from your menstrual flow. It usually lasts longer than your menstrual period. The menstrual period may last maybe 3 days, 4 days, or 5 days. But when it comes to lochia, when it comes to the vaginal discharge or postpartum bleeding, it can last up to 6 weeks. So some women, they may experience it for just 2 weeks. Some other women, it can last up to 6 weeks. So this is also normal. It's important to know this duration, because sometimes people want to scare you and say, "Oh, something is wrong with you. Mine lasted for just 5 days. Mine lasted for just 1 week." It is very normal. It is normal for it to last up to 2 weeks, sometimes 3 weeks, sometimes up to 6 weeks. These are all normal durations when it comes to the postpartum bleed, when it comes to the vaginal discharge after delivery. So after delivery, what are the things you're going to see in your vaginal fluid? What are the things you're going to see in your sanitary pad? But when it comes to this vaginal fluid, what does it contain? It contains blood, it contains tissues from the uterus, it contains mucus. As much as the body wants to get rid of these things, you don't need to engage in practices that can put you in more problems. So what are you supposed to see in this vaginal fluid after delivery? So from the time you gave birth up to about 3 to 4 days, its discharge will be bright red, contains lots of blood. You may see some blood clots in it. The fluid may be heavy. That first 3 to 4 days after delivery. So from that day 5, day 6, the blood will start clearing off gradually. And as the blood is clearing up gradually, it will no longer be as red as it used to be in the first 3 to 4 days. So it might now appear pink, might be seen more of pink color rather than red color. From that day 5, the color will usually appear pinkish. From that day 5 up to about day 10 to even day 14, the color will usually be lighter, more of pinkish color. So from that day 10, 14 to up to 6 weeks, sometimes 5 weeks, it will be more yellowish in color rather than pink or red. So if there's a continuous flow of more bloody discharge up to 1 week, 2 weeks, that's not normal. As you're seeing this discharge, you may feel some cramps in your abdomen, you may have some uterine cramps, and these uterine cramps will wane off as the day goes by. And that is why you need to rest after delivery. You need to take your prescribed medications after delivery. These are things that can help you soothe the pain, feel a lot better, because the womb is trying to contract to go back to how it used to be before you got pregnant. So it is normal to feel some contractions as the fluid is coming out from the vagina. So when it comes to postpartum bleeding, it's important to know what is normal, so that when something is going wrong, you know when to take action without delay. So this is what a normal postpartum bleeding should look like. It should get lighter as the day goes goes by. The flow should reduce as the day goes by. It can last up to 2 weeks. It can last up to 3 weeks, sometimes up to 6 weeks in some women. All of these things are normal. So what are those abnormal things to also look out for? Whenever you see any of these signs, it's important to check with your doctor without delay. And what are these signs? If you're discovering that you're just bleeding, it is bright red all through 1 week, it is still bright red. Day 5, day 6, day 7, it is still bright red. That's a red flag that needs to be checked. Or if you discover that you've gone through that early phase of bright colored vaginal discharge, you're already seeing the pinkish color, or you've even gotten to the phase where it is more of a yellowish color, you're almost rounding up, and all of a sudden you're seeing heavy bleeding. It is coming out heavily again. You're seeing more bright color discharge. The bloody discharge should not come back. So if you're seeing that the more bloody discharge is coming back, that's also a red flag. Or if you're seeing that the pain in your abdomen is so severe that you cannot tolerate it, please, you need to check that out so you know what will be going on with you. Whenever you discover that you're having thick blood clots in your sanitary pad, that early phase after delivery, you may see some blood clots. As that bright red vaginal discharge is subsiding, it's reducing, the blood clot should also reduce. But if you discover that you're just bleeding and you're seeing very thick blood clots, very big ones, even as big as a golf ball, it is important it is checked as early as possible. So when you're seeing very big blood clots, do not just say, oh, the bad blood in my body that needs to come out. No, these things can cause you more problems. If the blood is not clearing, the blood keeps increasing, the bleeding keeps increasing, you're seeing very big blood clots in the sanitary pads. No, these are not normal signs of postpartum bleeding. It needs to be checked and as early as possible. Or if you're seeing that you're feeling dizzy, you're not even getting yourself, you're feeling weak, you're feeling dizzy, like you want to collapse, please, you need to check that out as well. And if you discover that your body is hot, you need to check it out because that is a sign of an ongoing infection. An ongoing infection after delivery can become very dangerous. So as a new mom, you need to watch your body. If you discover that the discharge is having this foul smelling odor, you can't even stand the smell, it is so foul smelling, the smell is awful, it's having this very awful smell, you need to check it out with your doctor as early as possible. So when it comes to postpartum bleeding, there's the normal signs which I talked about already, and there's the abnormal signs to watch out for. The normal is that your body is trying to recover and take out what the body does not need. These were things that the body built up when your baby was in the womb. Right now, baby is no longer there and your body is trying to get rid of those things. So as much as the body is trying to get rid of those things, it doesn't mean that you should bleed for days or for weeks. It doesn't mean you should feel dizzy. It doesn't mean the discharge should be foul smelly. It doesn't mean you should have severe pain that is unbearable. These are signs that are not normal when it comes to postpartum bleeding. And unfortunately, many new moms have been told, these are normal, just bear it, it will go. And all of a sudden, before you know it, this mom is collapsing. Sometimes she's coming down with serious infection. Sometimes she's coming out in a very complicated state in the hospital. So as much as you can, pay attention to what is normal. If you notice any of these things that are not normal, ensure you're talking to your doctor and as early as possible. So I hope this video has been helpful so far, and I hope to see you in the next video. Until then, bye.